We're going to be talking about multiple sclerosis, presented by Louisa and myself. Here's a brief overview of the topics we're going to cover. We're going to start off with an intro and finish off with some 2 recent findings. And for our intro, so introduction and overview of multiple sclerosis. So multiple sclerosis is an immune-mediated disease. So that means that the abnormal response of the body's immune system causes the disease. In this case, the immune system attacks the central nervous system by mistake. And we know that the CNS is made up of the brain, spinal cord, and optic nerves. And when we talk about myelin, we're referring to the protective coating around nerve fibers in the central nervous system. This myelin is the primary target of the immune attack in multiple sclerosis. On the next slide, we'll be talking about the different types of multiple sclerosis and the different stages. So there are 4 main types: relapsing remitting, progressive, secondary progressive, and progressive relapse. There are also 3 stages: the prodromal stage, clinical stage, and post-clinical. The difference between primary progressive and secondary progressive affects the memory, speech, and reasoning. And all types of multiple sclerosis affects their motor function or their muscle movement. And on the figure to your right, you'll just see a brief overview of how you can go from no disability to full disability, where you need assistance with all movements and with feeding, for example. On the next slide, we'll talk about some demographics. So you'll see that it usually affects young people around the ages of 20 and 40, but they peak around 30 years. It's the second most common cause of disability in the US. The first is actually motor vehicle accidents. And it's more common in women by a 2-to-1 ratio. And it usually occurs more frequently in people with European descent and those that are closely related to European descent. And this could be due to temperature zones. So for example, northern US and Canada, but there are people with MS in warmer climates. On our next slide, we'll cover the etiology. So the cause of multiple sclerosis is not known, but it's believed that genetic susceptibility, infectious disease, and environmental factors can combine to trigger the disease. Autoimmune diseases are those produced by failure of the immune system to recognize and tolerate self-antigens. So this failure results in the activation of T cells and the production of autoantibodies by B cells, which causes inflammation and eventually organ damage. So on our next slide, we'll compare the normal nerve to a nerve suffering from multiple sclerosis. So in MS, the immune system primarily attacks the myelin sheath that surrounds the nerve fibers. These are also known as axons, as we discussed earlier in class. These axons are the long thread-like parts of a nerve cell, and the sheath protects these axons, kind of like insulation of an electrical wire. And that illustration there shows how the attack damages the myelin sheath. The immune system also attacks and causes damage to oligodendrocytes, and this makes it harder for the central nervous system to replace the damaged myelin. All of this leads to loss of myelin, or what we refer to as demyelination. So without the myelin insulators, the axons or nerve fibers also get damaged and can be completely severed. And that's why this disease is called a demyelinating disease. Next, Louisa will be talking about the pathology of multiple sclerosis.
So the pathology of multiple sclerosis starts with 2 fundamental processes. The first constitutes general pathological processes seen in MS patients, and the focal inflammation seen in MS patients results in macroscopic plaques and injury to the blood-brain barrier, which you can see on your computer screen. The second is neurodegeneration with microscopic injury, which involves different components of the CNS, including axons, neurons, and synapses, as Jhoanne said. The lesions are referred to as plaques, and they will occur in waves throughout the disease course, and I will show you a picture of that later on. The MS plaques predominantly center around small veins and venules and show sharp margins. Myelin loss, edema, and axonal injury are the chief components of plaque pathology. The blood-brain barrier disruption during active plaque inflammation corresponds to enhancement seen on MRI, which I will show a picture of later on. Over time, the inflammatory process subsides, resulting in astrocytic scars. So manifestations of MS are numbness or weakness in one or more limbs that typically occur on one side of your body at a time, tingling or tremors, electric shock, sensations that occur with certain neck movements, especially bending the neck forward, which is known as the Lormite sign, lack of coordination, unsteady gait, or inability to walk, partial or complete loss of vision, usually in one eye at a time, often with pain during eye movement, prolonged double vision, blurry vision, vertigo, problems with sexual, bowel, and bladder function, like Dr. Beto said, fatigue, slurred speech, cognitive problems, mood disturbances, loss of taste, swallowing problems, and seizures. And some more um, manifestations are on your computer screen, as you can see in the picture described. Diagnosis and testing. So there are no specific tests for MS. What they do is rely on ruling out other conditions with similar signs and symptoms, and this is known as differential diagnosis. So the first test they do is a blood test, and this will help rule out other diseases with symptoms like MS, and a test to check for specific biomarkers associated with MS that are currently under development and may also aid in diagnosing the disease. The second is a spinal tap or lumbar puncture, in which a small sample of cerebrospinal fluid is removed from your spinal canal for laboratory analysis. This sample will show abnormalities and antibodies that are associated with multiple sclerosis. A spinal tap can also rule out infections and other conditions with symptoms like MS. A spinal tap is the picture on your screen. The next is an MRI. An MRI can reveal the areas of MS lesions on your brain that I talked about before. You may receive an intravenous injection of a contrast material to highlight the lesion on your brain, and that will indicate your disease in its active phase. So as you can see on your screen, there's a picture with arrows depicting where the lesions are. The next is an evoked potential test, and that records the electrical signals produced by your nervous system in response to stimuli. An evoked potential test may use visual stimuli or electrical stimuli. In this test, you watch a moving visual pattern as short electrical impulses are applied to nerves in your legs or arms. The electrodes will measure how quickly the information travels down your nerve pathways. So as Dr. Beto said, there is no treatment, there is no cure for multiple sclerosis. There's only treatment that focuses on speeding the recovery from attacks, as well as reducing new radiographic and clinical relapses and slowing the progression of MS, as well as managing its symptoms. So the first are corticosteroids. Oral prednisone and intravenous methylprednisolone reduce nerve inflammation. Therapy will help manage leg weakness and other gait problems that are often associated with multiple sclerosis. Muscle relaxants such as baclofen and tizidine and cyclobenzaprine may help muscle stiffness or spasms. Medications to reduce fatigue include amantadine and modafinil and methylphenidate. Medications to increase walking speed include dalmafepridine, and other medications may be prescribed for bladder depression, as well for depression, pain, sexual dysfunction, insomnia, bladder or bowel control movements that are associated with MS. And as you can see on your screen, there's also 3 different types of treatments that may be given. They're injectable, oral, or infusion. Injectable include interferon beta medications, which may decrease inflammation and increase nerve growth. The oral include teriflunomide flunomide and dimethyl fumarate, which can also reduce the relapse rate. And the infusion treatment include natalizumab or creelizumab, which are monoclonal antibodies that have been shown to decrease relapse rates and slow down the risk of disability. So recent findings. Bruton's tyrosine kinase, which is known as BTK, is an inhibitor that is an emerging therapy being studied in relapsing remitting multiple sclerosis and secondary progressive multiple sclerosis. It works by mostly modulating B cells, which are immune cells in the central nervous system. Stem cells transplantation destroys the immune system of someone with MS and then replaces it with transplanted healthy stem cells. Researchers are still investigating this therapy and whether it can decrease inflammation in people with MS and help to reset the immune system. Possible side effects of these are fever and infections. I will now pass it back to Jhoanne, who will be talking about another recent finding.
So in this recent findings, it's titled Aging and Multiple Sclerosis. The link is on the bottom. Basically, they found that chronological age is the most relevant and strongly associated factor with how MS progresses. For example, very young patients have relapsing remitting disease, but if you get MS at a later age, the onset is more rapidly developing and you're more prone to having permanent disability. So the research is saying that if we understand the role of aging in the immune system and neural cell function, we might be able to find a key at halting non-relapse of multiple sclerosis. On our next page shows the references. And thank you.